The traditional classification of diabetes primarily distinguishes between two main types. Type 1 diabetes is characterized by an autoimmune destruction of pancreatic beta cells, leading to insulin deficiency. Type 2 diabetes, on the other hand, is primarily associated with insulin resistance, often linked to obesity and lifestyle factors. While this classification has been useful, it doesn't fully capture the complexity and heterogeneity of diabetes. New classification of diabetes, the 5 subgroups. Recent research has proposed a more nuanced classification system for diabetes, identifying 5 distinct subgroups: severe autoimmune diabetes, SAID, severe insulin-deficient diabetes, SIDD, severe insulin-resistant diabetes, SIRD, mild obesity-related diabetes, MOD, and mild age-related diabetes, MARD. This new system aims to provide a more precise understanding of the disease's various manifestations and underlying mechanisms. Group 1. Severe autoimmune diabetes, SAID. SAID closely aligns with the traditional concept of type 1 diabetes. It is characterized by an autoimmune response, with patients typically testing positive for GAD antibodies. SAID usually presents at a younger age and is associated with a low BMI. Due to the autoimmune destruction of pancreatic beta cells, patients with SAID require lifelong insulin replacement therapy to manage their condition. Group 2. Severe insulin-deficient diabetes, SIDD. SIDD shares similarities with SAID, but is distinguished by the absence of beta cell antibodies. It typically affects younger individuals with low BMI who have insufficient insulin production. Patients with SIDD are at the highest risk of developing diabetic retinopathy. Management usually involves insulin therapy, though some patients may also benefit from oral medications. The distinction between SAID and SIDD highlights the importance of considering factors beyond autoimmunity in diabetes classification. Group 3. Severe insulin-resistant diabetes, SIRD. SIRD is characterized by severe insulin resistance and generally affects overweight or obese individuals. Patients with this subtype are at an increased risk of developing diabetic nephropathy. Management of SIRD focuses on addressing obesity-related health risks and improving insulin sensitivity, with weight loss being a crucial component of treatment. This subtype underscores the significant role of insulin resistance in some forms of diabetes. Group 4. Mild obesity-related diabetes, MOD. MOD primarily affects overweight or obese individuals and is characterized by some degree of insulin resistance. The development of this subtype is primarily attributed to obesity. Treatment for MOD emphasizes weight management through lifestyle modifications, including diet and exercise. This subtype highlights the direct link between obesity and diabetes risk, emphasizing the importance of preventive measures. Group 5. Mild age-related diabetes, MARD. MARD is the most prevalent form of diabetes in this new classification system. It is often diagnosed in older individuals and presents as a milder form of diabetes compared to other subtypes. Management of MARD typically involves medications to improve pancreatic sensitivity to glucose. This subtype reflects the impact of aging on glucose metabolism and the need for age-appropriate diabetes management strategies. Implications for diabetes care. This new classification system has significant implications for diabetes care. It enables earlier detection and intervention by providing a more detailed framework for understanding the disease. The system allows for more personalized treatment plans tailored to the specific subtype of diabetes a patient has. Additionally, it provides a framework for developing novel, targeted therapies that address the unique characteristics of each subtype. Overall, This model has the potential to revolutionize diabetes care and improve patient outcomes. Take-home message. The 5-subgroup model represents a significant advancement in our understanding of diabetes. By moving beyond the traditional binary classification, it offers a more nuanced and precise approach to diabetes diagnosis and management. As research in this area continues to evolve, it is crucial for healthcare professionals to stay informed about these advancements to provide the best possible care for their patients with diabetes.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.